welcome. Suzanne Stell, Executive Director, and we are so glad you're with us in the middle of the day on a Tuesday. We appreciate you taking time to come and listen to everything going on at Shelton School. We realize you have a lot to do. We realize you've already done a lot. We hope that you've been able to take some time to renew and refresh and enjoy your family even more. We have missed you. That is for sure. We can't wait to see you again at Shelton. We please tell your children hi for us. They are what energize us and keep us going, but we continue to Zoom all the time to make sure we're charging forward. And today we're going to share a lot with you. You will be receiving all of this information on Thursday, so don't think you have to remember any of it. You'll get to see it all again. But before we get started, I'd like to tell you who will be with us today. I'd like to introduce our head of our middle school, Lisa Tyler, is with us. She'll be speaking. Our assistant head of middle school and associate head of school, Melanie Barnett, will be our moderator of questions at the end. We also have Eve Herman, our nurse, who's been very busy this summer. And we have Chris Brindell, who is our technology integration specialist, which of course he's been very busy also. I want to tell you that these people haven't had a break since March 12th. We've been doing this a long time, but it's because of your children, and they mean the world to us. We continue every day striving to blend the high quality education that we're planning with the safe health and well-being of your children involved. So it's a big task that's been put in front of us, but we are ready to do it, and we're ready to change course of action whenever we need to. Just for you to know, this time last week, we had a different slide to show you in the beginning. New information came out on Thursday, as you all heard, put us into a different course of action. We're ready to go and change course of action whenever we need to do, but I will tell you this, we want your children back on campus. There's no doubt. They're very important to us, and we know how the online learning, virtual learning is hard. I will tell you this, we appreciate what you did in our surveys. You helped us tremendously. But more than anything, we're trying to balance the high quality education with the well-being of your children. We would like you to type in your questions as you go and as you listen. And Chris, why don't you tell them what they need to do if you would, please?
So depending on how you are connecting to today's webinar, on a mobile device with the Zoom app, there should be a Q&A button up in the top right-hand corner. And if you are connecting by a computer, then the Q&A button should be located on the dock that pops up when you move your cursor.
Thank you, Chris. And also, I want to say a special welcome to our new families who are joining with us today. Didn't know we would be doing it virtually, but we're thrilled you're with us in the Shelton community. Okay, let's go. Got your questions coming in. Thank you very much. We wanted you to see what the parent survey showed. You all finished this survey by July 8th. In the middle of the surge, things have changed a little bit since then, but those given days, 86% want their children back in school, 14% want their child to learn at home. And we're going to be working on both situations, and we're going to be able to do both situations. But we wanted you to see your responses. I want you to know that August 3rd, we're going to send out another survey because we told you just do it what you felt that day. We'll get another viewpoint in August from you. Draft possibilities for starting school. What you will see draft throughout this entire document. As you well know, everything's dynamic, everything's ever-changing, and everything is fluid, and we realize that. We are hoping that we can have small groups meet together August 24th week so that you can see our new campus with your child. We hope to spread that out. You will sign up on a Sign Up Genius. We'll spread everyone out. We'll be doing all safety precautions, social distancing, mask wearing, everything. We just hope we're able to do that before everything gets started. If we're not, we'll go to our drive-through pickup supplies with laptops for our 6th, 7th, and 8th graders, and you're good at that. We know. We've already done it, been there. We can do it again. But we're still anticipating that we can get to have these tours with you during that week. Then we go to Shelton at-home learning. As you all know, what was stated on Thursday is that children could not be on campus in larger groups until September 8th. And we definitely, our new campus, many of you may ask this, yes, it's in Collin County, but the order was for Dallas County and the city of Dallas. So our new campus is in the city of Dallas, but Collin County, so it does apply to us at this moment in time. September 8th through at least September 18th, we want to have a safe and careful start. So this is where it's involving all of us to make a few sacrifices so we can do this well. Our middle school will be working on a hybrid schedule for those couple of weeks so we can get our feet on the ground, teaching the safety protocols to your children, at the same time working on a new campus. And Lisa Tyler will go over this with you, but basically we know we need to see middle school students every single week. Our 6th graders will be on campus 4 of the days every week, and our 7th and 8th graders will be on campus 3 days, and then the other part will be learning at home for just those couple of weeks so that we can get our feet on the ground. And then we're hoping everyone's back on campus September 21st with our entire school. Remember, draft at the top. We realize and we're ready to change direction whenever we need to, but these are our plans right now. Learning plans that we're doing Shelton on campus, Shelton at home, and hybrid, which I just talked about. We know how important it is to have our EC through 5th grade students on campus. It's very hard to do online learning with a 4-year-old, as you can only imagine. We also know our older students can do more online at times. So that's why we did our 6th grade through 12th grade. That will lessen our occupancy also, with half of our middle school students at school on certain days for those few weeks, and the same for our high school. We heard you on your surveys, loud and clear, what we need to do better. We also heard from you what we did well, and especially so quickly. So we just appreciate your feedback very much. We will be going over your concerns today: platform, communication, consistent time with teachers, and that emotional and social support. We totally agree with you, and all of these things have been addressed, and we've been working on them since March 12th. Want you to know that we have some new technology in our classrooms, thanks to the Moody Foundation for a grant that has allowed all of our classrooms to have a camera, iPad technology, so that we can live stream the classes. Our little ones have something different in their classroom, EC through 2nd, but 3rd through 12th all have the cameras, which you're going to hear about from Chris. And we just want to thank the Moody Foundation for making this possible. As you can imagine, all of this adds up quickly when we're trying to do the best situation for our children. The reason we think the cameras are going to help us so much, for one, your child will never miss out on learning if they have to be home for whatever sickness there is. Whatever time they have to be home, they will always be a part of the learning environment because of this technology. So thank you to the Moody Foundation very much. And Chris?
All right, good afternoon. As Suzanne mentioned, some of the new technology that we received, I'm going to go over that today. So I get my presentation, there we go. So to begin with, though, we're going to talk about Google Classroom for 3rd through 12th grade. Each teacher will be using Google Classroom this year. For those that are not familiar, it essentially becomes the student's learning hub, where all assignments, notes, projects, tests, quizzes, all of that information is presented and made available on Google Classroom, and that's where the students will complete those assignments and turn them in. Because we are moving over to Google Classroom, we are also going to start taking advantage of Google Calendar. And one of the biggest benefits to Google Classroom is that when teachers create assignments and include due dates, those assignments are automatically posted to the Google Calendar without any additional work on the teacher or student's end. One of the other great advantages of Google Classroom is that it is accessible from any internet connected device. So you could be, your student could be using this on the school issued laptop. They could also, if there happens to be a tablet at home, use the tablet to work on these activities. and it works fantastically with the use of an iPad. So if you happen to have an existing iPad at home, that would be a wonderful supplemental tool to have your students use. One of the big issues that we've been talking about a lot at Shelton is Zoom video conferencing versus Google Meet. We want to be unified in all of the platforms that we are using to make things easier for our students and our parents. And so to start the year, teachers who are actively using Zoom previously will be allowed to continue to use Zoom. However, our plan is that when we return from Thanksgiving, that teachers begin to use Google Meet exclusively. Part of that depends on features that are to be made available through Google Meet to match more closely to the Zoom features that the teachers really enjoy. So assuming that all of those pieces fall into place, our plan is then to use Google Meet exclusively. And the reason for that is because of its integration with the rest of the Google Suite applications. So as stated previously, some teachers may start with Zoom, but our plan is for all teachers to eventually move over to Google Meet. Regardless of what video conferencing platform teachers are using, all links for these video conferences will be posted in Google Classroom and only in Google Classroom. So you will not have to go hunting through various calendars. You will not have to go looking through emails. Your student will be trained to go to the Google Classroom to find the video link for that day's meeting. Some of the technology then that Suzanne mentioned, for all instructional staff, we will be able to issue iPads. This is for basically every classroom teacher. That iPad will then allow teachers to use it as a document camera to display concepts, showcase literature, uses for demos and labs within science classes, in addition to allowing teachers to remotely teach students either one-on-one or through small group instruction. For the 3rd through 12th grade classrooms edition, we will have Mevo Starts. These are very small live stream cameras. They will live stream to an unlisted teacher YouTube channel. That channel will be shared with the students through Google Classroom, just like the video conferencing links. The streams and videos will not be searchable on YouTube, and students' faces will not appear on camera. The teachers will be instructed to position the camera so that it shows the back of the students' heads, if it shows the students' heads at all. One of the greatest benefits to using these cameras, as Suzanne mentioned, was that students will be able to watch and learn in real time, regardless of why they may be out. But in addition to that, these videos will also be available afterwards for students to review, watch for reteaching, or even for tutoring purposes. So the next slide we have is a very short video that just kind of walks through some of the benefits and features of the Mevo Start. So we'll walk up. So new this year, through actually a request from a lower school parent, we're going to be providing parent training courses, and you can see some of the topics that we'll be covering. These will be live and on demand available. So I will be hosting these as webinars, very similar format to what we're currently in. Recordings will be made available, and I am have already created and will continue to work on supplemental documentation for these various platforms that we use. I do have 2 QR codes. If you don't get to it right now, it's perfectly fine. These links will be sent out afterwards, as well as this presentation. So you'll have access to those links if you don't have a chance to scan them right now. But the first one is available for signing up for these various trainings, Seesaw, Google Classroom, and Google Suite Overview. Seesaw will likely not pertain to you since this is for middle school. So Google Classroom and the Google Suite Overview would be 2 trainings that you can sign up for. The second QR code is where you can go to find the support documentation that will be made available. Currently, there's 4 documents on there right now, and that will continue to grow. So just real quickly, the difference between Google Classroom and Google Suite Overview trainings. Google Classroom focuses strictly on Google Classroom from the student's perspective. So accessing, completing assignments, turning assignments in, and the Google Suite Overview is going to be talking specifically about Google Drive, Google Calendar, Docs, Slides. And that's all I have. So I'll pass it back over to Suzanne now. Thank you.
Thank you, Chris. Appreciate all your work with that. And parents, sign up for those classes. They could be very helpful. I know they're helpful for all of us at Shelton, that's for sure. And one question you might have when we talk about our different ways to teach, when a child is at home, for example, maybe a parent chose that way, Shelton at home for learning, and then the child changes their mind. What do? All we ask is that we have a 1-week notice so that we can be prepared when the child comes back to class. We have that flexibility, which we're thrilled about. And the reason we ask for 1 week notice is because so we can have lab materials ready, all the books ready, any type of information, manipulatives that we need to have ready for your child, we'll have them ready. So now on to returning safely, the Shelton way. You received the document several weeks ago, so please know to refer to that. We will not be going over everything today. We're just going to go over some key points. Our goal, as we've said all along, is the health and safety of your children and our staff members. It's very important. You will see everything we've added, everything we will be doing. I think the areas that we're very pleased that we are able to have is our outdoor spaces. Lots of acres, 30 acres that we can spread out and learn outside, that's for sure. Also, we're going to have outdoor hand washing stations, which we're really excited about. And we'll have isolation rooms in the clinic. Those were already being built. We definitely will need them now. And we're very thrilled that we will have that opportunity to have those. Everything else you'll see, and everything else we will be doing. Physical distancing is a question that's come up on your surveys. We are very fortunate because we have the 30 acres. Believe it or not, our building space is 7.5 acres. That's equivalent to over 6 football fields, if you put it that way. It's a lot of space. We already have small student-teacher ratios, so we fit the 6 feet easily in our classrooms and throughout our building. So we're very fortunate about that. We also had our furniture design team, especially for our younger students, draw up, a 3-year-old, social distancing, that's hard. Middle school, it will be much easier for social distancing. But for you to know, even our young ones, we had the architects and the furniture design team draw up so that we would have space for our little ones. They would know their area. So we're very excited about what the architects and the design team have helped us with. Mask and face shields. We will be providing one thanks to a parent who is probably on today with us. Thank you very much, Prudence Graham, who's made 1,000 masks for us, for your children to have. We also will be providing a face shield. Many parents have asked, how are they going to see our mouths? We see our teachers wearing the face shields so that your children can learn and see us, but we're also going to have them for you and your child if they want one. We knew that most people would not buy one. So if we offered one, that they might like it a lot better. They seem to be much more comfortable for some students. For you to know, have a little fun with the mask. We're not requiring everyone to wear the same one. We sent a link on our previous document. It's on our website. It's masked for all ages. But we do ask you to please go ahead and order some. They'll have to be clean every day, so you'll need multiple ones as we begin the school year. But please know also we'll have extra. As we live in an ADD and ADHD environment, we get it. We totally get it. We will forget sometimes, so we will have plenty of extra masks, the disposable type, for our students. We realize also we have some students with developmental challenges or sensory issues, and we are going to be flexible with that. We will also have mask breaks, so please know that. We understand as adults we need that. So there'll be many more breaks where they're outside. Yes, where we can social distance, they will not have to have them on, but in large gathering places and where we cannot be 6 feet, we ask their cooperation in wearing them then. If your child is struggling with this, if you'll just turn it that we're trying to protect our staff, and it's going to be a comfort level for them also. So anyway, we appreciate everyone working with us on this. Screenings, we will have a daily symptom check. We're finalizing that app this week that you will have. Temperature checks are still being considered. For you to know, this is one area where everyone agrees that the temperature checks are just, they can provide a false sense of security. However, if it's a comfort to our parents, we may do it. At this point, we're still gathering information right now. Everyone believes that the symptom check from our parents is more important. And we realize we're going to have to depend on you as our partner in all of this. If your child has any symptoms of anything, to please keep them home. They will not miss anything because of the cameras in the classroom. So we're making it so much easier for families to make the right call on that. But we're still considering temperature checks. Visitors on campus, please be aware that we will be limiting all visitors on campus. We will be asking everyone to stay in their cars for carpool. This will be very important, and especially as we begin this school year. We're also asking you for 24-hour notice of appointments because that's going to help us. We're going to have a staff member involved with all of this. So just having a prior knowledge of these appointments will benefit us. Cleaning and ventilation, believe it or not, we're in a new campus. You know that. Almost 100% of our air conditioning system is brand new, and we have the high efficiency MERV 13 filters in place. EPA recommends MERV 8 for schools, and the next graduation of filters are for hospitals. So we feel very good about this. You heard about our cameras in the classroom with Chris. We also have our new video security system. And when all of this was coming up, all of a sudden, I got an idea from another school, and they said they had ordered cameras, video equipment that would help with contact tracing. And I thought, wow. So I immediately called our system, our video security system engineers to say, will our cameras do all of this? And they said, absolutely. We will have the most powerful cameras. So therefore, if a child, wherever our cameras are, especially if for some reason they are diagnosed with the COVID virus, sometimes we don't remember where we've been. So these cameras, we can identify the child in all these different areas where our cameras are throughout our building and on the outside. We'll be able to see where the child has been for contact tracing, which will be very beneficial for us. Also, high traffic areas and high touch areas, they'll also be able to help us with those areas. So we're very excited about that. And now it's Eve's turn. Eve?
Good afternoon, everyone. Again, my name is Eve Herman. I am the coordinator for health services at Shelton. I have Lisa Nagid, RN, who helps me in the clinic, and our job is to help keep everyone in the building safe. So this year it's going to be, we are going to be working with you and our staff, and it's a group effort to try to keep us all healthy and safe. There's a lot of confusion. I've heard through emails and text from questions about 10 days, 14 days, when do I stay home, when do I quarantine, when do I isolate? This is a really nice graphic that the Dallas County Department of Health sent us. And I'm just going to review it briefly. Again, as Chris and Suzanne mentioned, you will get copies of this. So you don't need to take a screen. If you want, you can take a screenshot, but we will be getting copies of this. On the left side, it reviews what you do or what we will ask of you if your child has COVID or has been diagnosed with COVID or has symptoms of COVID. We will ask you to isolate them at home until they've met all 3 criteria. They have to be home at least 10 days from the date of the first symptom. They have to be fever-free for 72 hours, and they have to have significant improvements in their symptoms. I've been told that sometimes the loss of taste and smell sometimes lasts for quite a while. It's mainly the cough that we're worried about. And as it says, you can return to school once all those criteria are met. And again, that number is the 10 days. The 14 days is if you are quarantined because you're a close contact. And I'll go over close contact in a later slide. We are not requiring testing to return to school. It's been recommended to us that we just use the time criteria. It's more accurate. With all the issues with testing right now, we just think this is the safer route to go. So for close contacts, if you have an immediate family member that's diagnosed, they should stay home for 14 days. And if they develop symptoms, then it reverts over to the other side. Hopefully by now you're all very familiar with the symptoms of COVID: cough, headache, sudden loss of taste and smell, shortness of breath, significant muscle pain, sore throat, diarrhea, chills or shaking, and a temperature over 100.0. I realize that a lot of these symptoms go with a lot of other diseases. That is going to be our main challenge this year. The pediatricians that we are working with are very concerned about flu season this fall. So we are strongly encouraging everyone, including our staff, to get flu shots as early as possible, and to please keep your children home if they have symptoms. This is where it gets really tricky. We have bad allergies here in Dallas. A lot of us suffer with that, and a lot of the symptoms are the same. Kids get strep throat, kids get ear infections, pink eye. They get lots of things that aren't COVID, and we understand that. Please bear with us. We are going to err on the side of caution. We will be sending home a lot of kids that don't have COVID in the beginning for sure, until we kind of get a feel for how this is all going to work out. I can tell you the private school nurses are meeting once a week. Now we've gone to twice a week with the Department of Health. This is our main topic of conversation. What do we do with the kids that have just a headache? Middle school kids love to come see me with headaches. And, am I going to send every single one of them home? I may. So please just be understanding about that, because headache is one of the main symptoms of COVID. If your child does get sent home, we will ask you to see a healthcare provider. If the healthcare provider decides that it's COVID, please let us know. If your healthcare provider decides that it's not COVID and it's okay for your child to come back to school, we're asking them to fax me a note. And again, you don't need to write this fax number down. It will be sent out to you. If you choose not to see a healthcare provider and we've sent your child home, you will need to meet the same 3 criteria as if they had COVID. And again, this is a tricky area, and we're going to work really hard with you and your kids to try to keep them in school as much as possible, but also keep everybody safe. Okay, there's been some changes with this and some confusion about what is a close contact. At this day and time, this is how it's being defined. A close contact is having been within 6 feet or less of a confirmed case for at least 15 minutes or more. Some sources say with a mask, some sources say without a mask. We're going to say either way, either with or without a mask. If you've been within 6 feet for more than 15 minutes, you are considered a close contact. If a student is considered to be a close contact, he or she will have to stay home for the 14 days. Now, we've gotten questions about the classroom. If someone is infected, will the whole classroom need to be sent home? We're hoping not. We're hoping that we can just identify those students that have been within that 6 feet parameter of the students, so we do not have to send the whole class home. Again, just a reminder, anyone that's quarantined at home, if they're feeling fine, they'll still be able to participate in the classes with the use of the cameras. So they shouldn't have to miss out on any instruction time. Also to let you know, we will keep a running graphic with who, and not who in particular, but how many students and staff have been diagnosed with COVID. This will be password protected on the Shelton website. We will give you the information how to access that data, but we will keep that up to date. So if you want to check to see what the numbers are at the school, you can do so. Of course, anyone that is a close contact and needs to be quarantined, or anyone is in a class with someone that's been diagnosed, we will certainly notify you. We will also certainly not be telling you who the child is that is infected, because we need to protect confidentiality. I've gotten several emails about this, so just wanted to clarify this for you. For the rest of the summer or during the school year, if you travel within the United States, you will not need to quarantine when you return to Dallas. But if you travel outside the United States, you will. So just keep that in mind when you're making your travel plans. And I'm gonna turn it back over to Suzanne.
Thank you, Eve. Appreciate all the work you're doing. And as Eve said, we're continuously meeting with different groups each and every week. We've done it since March 12th, which is very helpful for us. This is an attendance email. Just wanted you to know, and as Eve said, and we've all said, you don't have to remember all this. It will be sent to you, but we're going to ask your help in this. If your child is homesick with any symptoms, we would like you to email. Yes, you can let the advisor know, but you don't have to if you remember this. We would like you to put all the symptoms in writing to us so that we can definitely be on top of all this. And then this will be directed to our nurses at Shelton so that they can make the phone call home to make sure we're doing the right thing at Shelton that we can do, and that you understand everything that you have to do as a parent. This will be important because of the days out and the 10 days versus 14 days and the symptoms and everything. So we feel like in writing instead of phone calls is going to very much help us this year. And now I'm going to turn it over to Lisa Tyler, head of our middle school, and she's going to go over some questions that you had from your surveys.
Hello, I am Lisa Tyler, and I am head of middle school. And I'm so glad that you were able to join us today. I can't tell you how much I'm looking forward to meeting with you in person, to be able to see your faces and to make the association between parent and student. I know we're all longing for those social connections again. As we look at this first slide, you will see that we had strong parent responses. Out of 315 students, we had 250 parent responses. Parents, your input has been invaluable as we have worked to address the needs of our students. So thank you. Thank you for taking the time to pose questions, to acknowledge our efforts and offer your support. All are greatly appreciated. In regard to our safety plans, Eve's gone over this, Suzanne's gone over this, but I want to reassure you, yes, we'll be wearing masks. This is for the protection of our students, our teachers, and our families. When students arrive for morning carpool, they'll need to wear a mask as they walk through the hallways, as they leave for afternoon carpool, anytime they're in a common area where social distancing isn't available. Masks need to be worn. In the classroom, they'll wear it upon entering the classroom, but once everyone's settled in their own desk, then an appropriate distancing is established, then the mask can be removed. We've also got the face shields. At any time that a teacher needs to approach a student's desk to work individually with that child, or the child approaches the teacher's work area, a mask will need to be worn. We recognize that our students may have concerns about wearing masks, and our teachers are going to be very sensitive to this. Our number one concern is your child's physical, mental, and emotional well-being. We're going to work to safely schedule mask breaks, as Suzanne said. So throughout the on-campus days, we'll work for these, as well as we'll have many opportunities to go outside for fresh air. We recommend that your student begin trying on different masks. We encourage you to find one that's comfortable for them, but let them have fun. Like Suzanne said, let's pick out one. These are now considered accessories. So let them choose one that maybe represents their favorite sports team or college team, or maybe just their favorite color. Our only requirement is that any text, symbolism, or graphics be appropriate for our school setting. So let's have some fun with it. Keep in mind that these masks do need to be washed daily. As far as cleaning, Shelton has hired additional cleaning crew to assist our current staff. And at the end of each class period, surfaces will be wiped down in preparation for the next class. Our new 30-acre campus beckons to us to come outdoors and enjoy the beautiful trees and the fresh air. So we're looking at possibilities of setting up tents for certain events, like for band or for choir, and teachers will be encouraged to go outside. Let's get some fresh air, and lunches can be eaten outside. This will all be scheduled. We're so fortunate, again, to mention our high quality air ventilation and this brand new facility. And then finally on this slide, we are asking that parents remain in their cars at carpool. And I know this is going to be a challenge for all of us. It's going to be a challenge for us as administration because we enjoy talking to parents. So I can envision myself, Ms. Gallagher and Ms. Barnett outside at carpool so that we can wave to you and hopefully get to chat with you a minute in some form or fashion. If your child arrives late to school, we ask that you call the middle school office and we will meet them at the door. If a child needs to leave early for an appointment, we do ask that you try to notify us through that email address so that we can be prepared and have someone take them to the door. It is not our desire to keep parents out, but it is our desire to protect our students, our teachers, and our families. So, morning and afternoon carpool. When a student arrives at school, they will go directly to the designated area for their cohort carpool. In the afternoon, students will wait in their advisory until their name is called, and then they'll head directly outside to their car. We began this process about last January in preparation for School Pass. Again, we ask that parents remain in their cars. For our passing periods, we have planned a 15-minute staggered passing period to reduce the number of students in the hallway as well as in the restrooms, and it also allows time for sanitizing desks and other surfaces. During our morning carpool time, one cohort will be able to go outside for about a 10-minute period. The other cohorts will have an extended time to finish classwork, begin homework, file papers, maybe read. We even have some teachers who are looking forward to using this time to read aloud to their students. And nothing's better than being read to. I think we all enjoy that. So our middle school schedules, as Suzanne mentioned, we have 3 scenarios. We have Shelton on campus, Shelton at home, and Shelton hybrid. Shelton on campus will resemble a traditional school day. For the safety of our students, students are assigned to cohorts. Parents, you have the option. Your student can be on campus or they can be learning at home. Both options will be offered throughout this school year. Our only requirement is if you choose to change your option, you give us at least a week's notice. This is if you're wanting to change from on campus to at home or from at home to on campus. We're asking for this because it provides us time to prepare the student as well as gather supplies and things that they will need. Our next option is Shelton at home. This schedule aligns with our Shelton on campus schedule because it will allow teachers to teach simultaneously to the students on campus in front of them as well as those at home. Students in the at home learning scenario will be members of a cohort. They'll be members of that advisory that the cohort is in, as well as their classes. So how will this work? Well, the Mevo cameras that Chris Brindell mentioned earlier will allow teachers to teach and live stream those lessons. For additional support for all of our students, these lessons will be recorded and be able to be viewed later for review or just extra support. In our at-home scenario, you see that 6th, 7th, and 8th grade, Monday, Tuesday, Thursday, Friday, they'll have our typical schedule. We'll run through the day just like we would if we were on campus. If we're all at home learning, we want to make Wednesdays a special event. And below here, you see our Wednesdays. We want to dedicate Wednesdays to supporting our students socially and emotionally and meeting those individual needs through connections. One of the things that we're looking forward to is having charger mentors, someone who can meet with students one-on-one to discuss what they're experiencing at home, also just to help them set goals and dream dreams and just try to move beyond what we're dealing with in this current situation. This will also provide advisors a set time where they can communicate with parents through email, through phone calls. We want to stay connected to you if we're mandated to be at home. It will allow time for collaboration among students, independent study, counseling time. We're also looking forward to setting up some Zoom lunches. This is something Ms. Gallagher is looking forward to, and having special breakout groups. Our speech department can help us with the social thinking. Teachers will have office time, and it'll be a time where STUCO can meet. We hope to have some community service projects. All of this is part of our plan if it's mandated that we all be at home in this scenario. Then there's our hybrid plan. Our hybrid scenario, this schedule allows for a reduced number of students on campus each day. Students receive the benefit of the face-to-face interaction with their teacher at least 3 days a week. And students alternate between being on campus and at home, as you see in this schedule. 6th graders would be on campus Monday, Tuesday, Thursday, Friday. Wednesday would be their only day to be at home. 7th grade would be on campus Monday, Tuesday, Wednesday, and at home Thursday and Friday. 8th grade would be at home Monday, Tuesday, and on campus for the remainder of the week. Students would meet in their assigned cohorts when on campus, and then when they're in e-learning, it's still with that assigned cohort, it's just virtually. The schedule offers consistency for our families, we hope, so that they can plan ahead. So let me explain a little more about cohorts. Our cohorts are designed to reduce the number of students who come in contact with each other throughout the day. We have 3 cohorts for each grade level. Just for the sake of being able to discuss these, we'll call it the blue cohort, the orange cohort, and the green cohort. Within each cohort, there will be 3 to 5 advisories, depending on that grade level and what is needed. How do we choose these cohorts? How did we come up with this plan? Well, as always at Shelton, we carefully look at each student's learning profile and what's best for them. So the cohorts have been established based on the needs of the students within that cohort. When possible, teachers have been assigned to only one cohort. However, because some of our teachers teach more than one subject and more than one grade level, there are times when they are assigned to more than one cohort. Students learning at home will be part of their cohort advisory in classes. I want to make sure everybody understands that they still will have a place within that cohort. The emotional and social needs of our students, we realize how crucial this is for learning. You can't separate that from the academics. So in our Shelton at home scenario, if we're all mandated to be off campus, we built part of that week, we've designed it to meet these needs, and that was that Wednesday I discussed. Other ways, even if we're on campus or if we're in the hybrid, we still want to work on those Zoom lunches so students can interact with each other, work on more collaborative projects, even if it needs to be virtually. We really want to make a focus to connect students with similar interests. Ms. Gallagher is excited about the possibility of establishing some clubs. And then also some get to know you activities. This is important for all of our kids, especially our new ones, but of course, utilizing social distancing. We've already talked about some one-on-one coaching time, and then some mix it up seating with our outdoor lunches. New students. As of right now, we have 47 new middle school students. We're excited and we welcome you, parents, if you're attending this today, and we can't wait to meet your student. Many of our new students have come to us since we've been in quarantine, so we've not actually met face to face. So it'll be a big day when we can all be together. To reassure you, parents, your new student will be assigned a buddy within their advisory. Again, that advisory is within their cohort. We always have new student parties to welcome these students and to help them make connections. This year, those new student parties will happen within the cohorts. Again, get to know you activities will take place. Patricia Gallagher, middle school assistant head, and our counselor, Dana Klein, will meet with our new students regularly in small groups to make sure that they're acclimating to our Shelton Middle School. Shelton will provide, as always, the MacBook Air laptop, the carrying case, and the power cords. We insist that students use this carrying case. It's there to protect the equipment. We will provide the Shelton binder and everything that needs to go in it to keep it organized. The pencil bag, the pencils, the highlighter, folders, composition notebooks, and notebook paper. But this year, because we are not going to be able to share materials that we typically keep in the classroom, we're asking that parents provide those materials. The newsletter that was sent out last week provided links to what you could call a supply list. And these links are also included in this PowerPoint. Again, you're not required to purchase those through Amazon, but they're definitely there should you want to go that route. We recognize, though, that you may prefer to shop at Target or an office supply. So what about lunch? It's an important part of our day. Sage Dining does an incredible job of providing our students with nutritious and appealing meals. They're still going to do that. This year, though, they have taken on the task of keeping us all safe, or I should say safer than they have in the past. They will still serve those plated lunch options, but they will be covered with saran wrap. They'll also be serving individually boxed lunches, prepackaged items. We do not intend for our students to eat sandwiches every day. Sage is working on that. Students will spread out in different areas for lunch, sometimes in a classroom, outside, and of course we have our magnificent dining hall, and we will work a schedule so that students can experience that. Of course, Sage always keeps food allergies in mind, and you can find information about that on our website. Electives. We're working on scheduling the electives. Electives will take place within the cohort. As I said earlier, band and choir will most likely meet outside under a tent, covered area. PE will be spread out to maintain social distance. And we're working to be sure that all of the other electives that we offer, we're able to group students by cohorts appropriately. If we are required to go to at-home learning, electives will continue. They will take place daily at their scheduled time. If you opt for your student to be involved in at-home learning, beginning while some of us are on campus, if you opt for that, they still will have that elective. And then of course, sports, that decision has not been made yet. After school care, we know how crucial this is for many of our families. So yes, we plan to offer that. We're working on plans for the logistics of this. Again, keeping students in small cohorts, trying to work on the small sizes so that we can maintain that social distance. But again, our classrooms are large, we've got the space, and keeping it a very structured time so students can go from class, have a break, and then begin their homework for the day. We also hope to offer some after-school activities and clubs just as we have in the past. As Suzanne said, that survey is coming to you August the 3rd. In that survey, we're going to need information from you to help us plan. We'll need to know, are you planning to use our aftercare program? Are you thinking you would like for your child to be on campus or begin the at-home learning? This again will help us in our plans. If you have any questions about what I've covered today, please do not hesitate to reach out to me, to Patricia Gallagher or Melanie Barnett. We welcome your comments, we welcome your questions, so please do not hesitate. We so appreciate your support and the opportunity to work with your student. So I will hand this back to Suzanne.
Thank you, Lisa, for all the information. And thank you again, parents, for what you continue doing. Your partnership since March 12th has been incredible. And we haven't said thank you enough. So please know how much we appreciate what you continue to doing in these uncertain times for all of us. Please know you have a team at Shelton here to help at any time. We're in this together. We're not in it by ourselves. This pandemic will get under control. Medical doctors are working on all aspects of it. as we are meeting today, we do realize that. And we're just excited to figure out all of these plans and excited to bring your children back on campus. But we can't say thank you enough for your support at everything we've done since March, forever, truthfully, but especially in these trying times. Now we know that several of you have some questions. We know we may not can cover them all, but Melanie Barnett will be our moderator, and she'll ask the questions and we'll answer them and we'll just go. We know some of you have to leave us at this time. This is being recorded for you. We're going to end on a high note with drone pictures of our new campus. But anyway, Melanie, let's go. Let's see if we can.
Okay, Suzanne, there's the question of the new campus being in Collin County and the orders being for Dallas County. So which do we follow, and what if they extend for Dallas County past September 8th? All of those questions.
We'll have to change course of action. At this point, the order was for the Dallas County and public and private schools in the city of Dallas. So if you read the last sentence in the order, and believe me, we've done this all which ways. I want to tell you, if you heard last week, the religious schools, the religious private schools have already gone a different way. Our lobbyist right now, all Texas private schools, we pay someone to be our lobbyist in Austin. She is working on our behalf right now. We even have a call tomorrow to figure out what direction the other private schools will be able to go. We do think there's going to be some updated information coming out. We also have, since we work with learning differences at Shelton, we have another angle that we are also pursuing. I will tell you that. But remember, when we're doing all this, the well-being and the safety of your children are in mind, but we absolutely know we need them face-to-face and to learn better, I should say. Please know that hybrid model is only for a couple of weeks in our mind. So if the Dallas County comes back and it includes the city of Dallas, what direction, it depends on what private schools are doing at that moment in time with what our lobbyist is doing. So I hope I'm making sense.
Yes, and there was a question about pushing back and adding days to the end of the year. Did we consider that?
We can always do that. We can go through May 28th is on our calendar right now, and we put that in our document earlier. So absolutely, that's an option.
Okay, and then just as you've addressed, there's just really, really strong feelings for wanting the kids back in school on August 26th, you know, to start. So I know the building is part of our consideration as well.
Yes, yes. As you can imagine, the virus, our construction crew has not been immune to the virus. But at this point, for you to know, we moved out of our campus last week. 14 trucks showed up on Monday. They worked for 6 days. We're out. We have moved to the new campus. We did a walkthrough this morning with the academic classrooms. They're making tremendous progress. We are hoping to have our occupancy, certificate of occupancy, August 10th. And they feel like everything will be finished. Now, let me say what everything is. We have phase 1 and phase 2 of this new campus. We knew from the beginning there's things that aren't going to be finished. What's not going to be finished when we move in will be our fine arts area. They tell us it'll be through the end of September, so we already have a plan for that anyway. But the performing arts auditorium and all the field house area with the stadium, that's phase 2, and that's been in the plans for years. But when we move in, there's one little section that's not going to be ready, but they're moving on it. They say it will be finished, and we're going to get to do what we want to do August 24th week if everybody tells us we can.
Okay, this is from a new parent. A good question about what is the average size of our classroom and the average class size with students?
Perfect. Average class size, our student teacher ratio is 1:6. Average in a classroom is 10. Average size of these new classrooms on our new campus is probably about 650 square feet to over 1,000 square feet. They're very nice size. As you all know, 6 feet, 45 square feet per child. Now the American Academy of Pediatricians and other sources have put it down to 3 feet. We're going 6 feet with that 45 foot square foot per child. So we feel very good about that space. These cohorts, which they describe to you in middle school, that doesn't mean 33 are in a class. I want to make you aware that means the 33 are divided up very small, but they rotate in different cohorts with that 33. So make sure they're not 33 in a class.
Okay, there's a question about carpool. Will we have a policy that only related people can ride in carpools, or is it up to parents?
It's going to be up to parents. We realize that would be wonderful if we could do certain cohorts for Carpool, but we realize we have over 100 zip codes that come to Shelton, and you've got to rely on Carpool and all. So we get that. So we just can't. But once we do contact tracing, if that happens, then the Carpool will be involved. But doing our cohorts through 8th grade is pretty amazing. You can imagine the scheduling situation we had, but we're still narrowing it down to if we just had them passing from class to class.
Okay, questions, let's see. Can a student walk or bike to school?
Yes,
Will the
absolutely. And we'll, you know, the talk in the high schools where our electric car is going to go. I'm like, we're not there yet. We're not, but at least in middle school, we're on bikes. That sounds good.
Okay, will teachers wear the mask or the shield in classes?
A lot of teachers are going to do both unless they're teaching so that the child can see their mouth, if that makes sense. There are also masks that our speech and language clinic and our evaluation center are wearing that are the masks that have the clear around the lips. Some of our teachers are going to choose those too. But we realize your children need to see them.
Okay, these are some tech questions, so maybe Chris can jump in here. One is about Google Classroom. How can the parents see those assignments or get the child's calendar shared to their Google Calendar?
So as far as sharing between Google Calendars, I believe I will double check to verify, but I think that the way that we have our Google accounts set up is to keep it closed off outside of our domain simply because of the security that can arise if we open that up. So as of right now, I do not believe that it can be shared with an external account. To address more specifically the Google Classroom, students will be able to log in wherever, obviously at home. And so if a parent is wanting to check on a particular class, they can have their student log in and just show them, you know, kind of over the shoulder type situation. So with Google Classroom, if you're not familiar, you know, as far as like communication with guardians and teachers, it's kind of an automated process that the teachers can voluntarily turn on. So there's not really anything that's going to come directly from Google Classroom to the parents specifically. So if you're wanting to see some of that information, just have your student log in and you can view it kind of over their shoulder, as I mentioned.
All right. And also, Chris, are changes being made and updates to Google Meet to give it the same functionalities as Zoom? $1 million question.
Yeah, it is. So we really, you know, as I mentioned earlier, we really do want to move over to a unified video platform. Google Meet is hopefully going to be providing some of those updates so that we can get into Google Meet using Google Meet sooner rather than later. But yeah, it really does. They have listed out, and I can, you know, whatever information we send out, I'm happy to include the announced features that they plan on releasing in the fall for Google Meet, but it does include things like breakout rooms, moderator controls, so it gives the teacher finer controls over the classroom, or I should say the Google Meet. And then there's also some extensions that we've been looking at that can kind of tie in some additional features that Zoom has inherent that Google Meet doesn't currently. So we are hoping that this fall, those features, they have not given any indication as to when those features are going to be available, but they are specifically creating them for the classroom. So it could be a matter of weeks. It could be middle of September when they're released. At any rate, we're hoping that by Thanksgiving, we'll be able to switch over to Google Meet, pending those updated features.
Okay, Chris, one more for you. The kids who are doing at-home learning while either by choice or in hybrid, there's some at home and some in the classroom, will they be able to interact with the class or just watch it on the video? So as of right now, the cameras that we have are only going to be streaming to the live stream platforms like Twitch, YouTube, things like that. So as mentioned earlier, we'll be using YouTube live streaming. And the way that YouTube is set up, there is not going to be audience interaction
And part of that is nice because the teacher is in the classroom, they're trying to manage the technology, they're trying to manage the lesson, and they're trying to manage the students that are in class. So trying then to add a fourth managerial responsibility on the teacher is starting to kind of tax and ask a lot of the teachers. So the idea here would be that the student would be able to watch in real time, maybe take some notes, and then during these opportunities where students and teachers can connect one-on-one or in small groups, those will be the opportunities for students to be able to ask questions and get clarifications on that day's lesson.
And also to answer that too, Chris, with the iPad, especially our high school teachers with the high school age, a lot of them want to turn on the interaction part with the Zoom or the Google Meet on their iPad at the same time they're live streaming. And we don't know how distracting that will be for 6th, 7th, and 8th graders, but there is that possibility of that interaction at that time.
Yes, and in talking with the developers over at Mevo, they are planning to release some updates that will allow that camera to stream to a Google Meet or to a Zoom. But a lot of this, everything's up in the air, and unfortunately, nobody at Shelton works with these or for these companies, so we don't have any insider trading information, unfortunately. But there is a lot of information coming out about supposed features that they're hoping to release. The camera, they say by the end of the summer, which is September 23rd, by the end of the summer, they would have the webcam version available to wired into a computer, but then sometime in the fall that they would release a new update that would allow the camera to wirelessly connect to those Google Meets and to those Zooms. And so that would allow for that interaction piece, should it not be too confusing or taxing.
Okay, next questions are going to be for Eve and Suzanne. Eve, a parent has asked about the Kinza app that we started using a couple of years ago, if we're going to use that.
I would love to. For those of you who are new to Shelton, we have partnered with a thermometer company called Kinza. It was a smart thermometer. It is a smart thermometer. They have a wonderful app where you can anonymously document any symptoms your child has. If your child has fever, and you can log on to the school, our school section of the app, and it'll tell you what's going on in the school. I had checked earlier in March, and we lost our school portion of it, but I was in contact with them, and they're definitely going to add us back in. So yes, we can do that, but I will certainly send out more information once that's all set up.
Okay, there are other concerns. The difference between the diagnosis is 10 days with qualifiers instead of 14 days.
That's all very confusing, and that's why I was hoping to clear that up. Let me try again. The difference between the 10 and the 14 days is that the assumption is that you are contagious for a couple of days before you show symptoms or before you get tested. So that's why it's just 10 days. The 14 days is the period where you can get and show symptoms is between 2 and 14 days. So if you are exposed to someone and by day 14 you haven't shown any symptoms, you more than likely will not.
All right.
I'll clear that up.
Okay, another concern is that cough can last for weeks, but we're requiring them to be asymptomatic.
Not asymptomatic, just improved.
Okay.
It can be we've had some children with asthma who just can't stop coughing, and it's not only distracting to the student because they're uncomfortable, it can be distracting to their classmates. So again, there's some wiggle room with all this. We just want them to feel well enough to be in school and be able to participate.
Okay, if a parent knows their child gets regular headaches, their doctor knows this and all, can they send a note so that we don't send them home because they know that they're going to get these headaches?
Certainly, we know we have students with migraines. We know we have students, at that time of month that get headaches. Yes, certainly, we will take that into consideration for sure.
Okay, if they're from the doctor's office, can they communicate in a way other than fax? That was asked.
Sure, they can do email. I don't know. They can they can certainly call and leave a message if we can't answer the phone. Absolutely. We just thought most Doctors' offices are comfortable with the fax because it's secure. Some don't feel comfortable with other means, but absolutely we'll be flexible on that as well.
Okay, for our families that have multiple children at Shelton, the parent asked if one of them has symptoms, should they keep them all at home?
Not necessarily. They would only need to keep them home if their doctor decides that that child has COVID. If they have an ear infection or strep throat and it's not COVID, then the siblings don't need to stay home. But certainly if somebody has COVID, then the whole family will need to quarantine.
Okay, the next one's about notification. Several questions about if their child is in the class or the cohort with the student, but not determined a close contact, will they be notified? How will we handle that?
Definitely. And you will then, if we have determined that your child is in the cohort, but was not within that close contact definition, and if you decide you want to keep your child home to be safe, you absolutely can do that. But whether we ask you to do so or not, but definitely we will be notifying anyone within a cohort if there's a positive within that cohort, for sure.
Okay, this may be for Suzanne. Are we going to require parents to sign a contract that they will agree to follow these best practices, just to try to improve, everyone following it?
It's called an acknowledgement form. And yes, we'll be sending that home in August so that we can all be a part of the community, because you're exactly right. It's going to take all of us to make this work, and we're determined to get that across. So yes. Melanie? Uh-oh. Our moderator went off. That's not good. Well, guess what? We have all the questions recorded, so we will be able to answer them if Melanie doesn't come back on. Sorry for that technical glitch. But anyway, we have them all recorded. There she is. Mel?
Sorry, mine froze for a second. I apologize. Okay, Susan, there's some questions about the hybrid model.
Yes.
One being, when would we go to that? What is that, the goal of that first? That's the first one.
At this moment, the dates were on the form, which was September 8th, right? To the 18th?
Yes, yes.
My memory working today? Good. September 8th to see down at the bottom. September 8th. Yeah. September 8th through the September 18th. We want to start that way before we get everyone on campus. So the question was, we're doing that at this moment in time. You see draft at the top. Things can change. However, we would like a safe and careful start with less occupancy before we go everyone on campus. Did I answer the question, Mel?
Yes, you did. And that, I'm sorry, so we will be starting the 26th with at-home learning, but then the hybrid, yes. we want the kids to have time to hopefully meet their teachers before they start complete e-learning. That's our goal. But we're starting, the parents wanted clarification on the start date. So it's kind of confusing. Of school, yeah.
August. We're hoping to use the entire week of August 24th to get people up there to see with small groups, multiple days, multiple divisions, spread out, all safety protocols. But yes, the Shelton at home learning, August 26th. And that looks like the boot camp that we're going to be doing with all ages to get us all started, because, as everyone says, we need to be ready for all of this.
Okay, perfect. And then a parent would like, and this was some feedback we got in middle school during e-learning, they want to know when their child does not attend a Zoom class when we're in e-learning.
We agree with you, and we will do that. Absolutely.
Okay, a question about early morning. What about, have we made a decision about kids arriving if they need to arrive before 8?
If you will call Lisa, we'll ask this question in our August survey so that we kind of can get our head wrapped around. It will cause a challenge with our cohorts, definitely. So we're going to have to, we would do very small, but we realize we have 100 zip codes. Everybody can't get in at the same time. We're asking if they could come in a little later, instead of like the 7:15, 7 to 7:15 time, 7:30 time. If you could back it up a little bit, it just helps us with the children. But we realize there's going to be situations we have to work with. So definitely reach out to Lisa Tyler, and we'll be asking those questions to the best of our ability for everyone.
Yes. Okay, a question about lunchtime. How will we space children, or will there be a certain number of kids at each table?
And cohorts will be at lunch, but remember there's 33, and especially in middle school, so it won't be just one advisory because they've already mixed with some of the other kids in different times. So when Lisa went over that mix it up, it doesn't mean we're just going to mix it up with all the cohorts. It means within that cohort. And yes, we're going to get them out of their classroom, eat outside. We're going to have a rotating schedule. We've got a lot of open space. Our commons area, our dining room, we have a courtyard where they can get outside and eat. So we'll have to spread all of that out in a very detailed way, which we're already working on.
Perfect. And the last question, will the construction crews who are still working on the fine arts area be on campus with this at the same time the students are on campus?
There will be a part of the construction that will not be finished, which will be our fine arts. It will be totally blocked off from the rest of the school that they will be working on. They tell us. Now, miracles happen. However, that's the one part that they will be in that area. Yes.
Okay. Sorry. Okay, there's some other questions on here, parents, and I hope you can tell that we've been working hard on this, and I want to thank you. It's so nice as I scroll through here to see all these.
Uh-oh. She went off today, but what she was trying to say, it's so nice to see all the wonderful compliments. There she is.
Am I breaking up? I think
Yes,
my internet.
that's okay. It's the virtual way.
Yes. So if you have a question that did not get answered in the group, please know that we will reach out and we will get your questions answered.
And again, we can't thank you enough for your support. We're in this together. We're not alone. We are going to be able to do this. And we just appreciate your family. And please tell your child hi for us. We miss them very much. Then we'll be back in contact with you. You know, we've been communicating all summer. Thank you for being involved. We'll have another one of these in August, that's for sure, so that you can even ask more questions. And then we'll be adding frequently asked questions to our website so that you'll have that access. And then you will also, this will be sent to you. So we're trying to communicate as much as we can, but do not hesitate to ask questions. Please reach out to Lisa Tyler and Melanie Barnett, any of us, and we'll answer your questions. But again, thank you. And now let's at least end on a high note of pictures of our new campus. You all have a great day and a great week, and we look forward to seeing you again. Take care.